coronaviruses, specifically the one which is the novel coronavirus, is thought to have arisen from animals. And this is not the first time this has happened. We've had previous attacks, like you remember the SARS epidemic a few years back. We also had the Middle East respiratory syncytial virus, that is MERS, that's another coronavirus. These two coronaviruses have affected mankind in the previous decade or two. Now, this particular one is also thought to have jumped from the animals to human beings. And as you may be aware, it was traced to a certain market in Wuhan. It is thought that either bats or snakes are the reservoir, and unfortunately so far we do not know what the real reservoir is. But it is thought it jumped from those animals. Maybe people were in close contact or they ate the animals, and this now led to the human being being affected. So far the science shows as if the methods of spread are similar, and this is mainly contact and aerosol. By contact, you know, we touch our faces very, very frequently, and if I have touched someone who has got fluids which contain this virus, I can easily transmit them to myself by touch. Similarly, if you are close to someone who is coughing away and the viruses are becoming aerosolized, one can inhale those viruses and the disease can manifest. Once one has been exposed to the virus, it takes some time before the signs manifest, and we call that period an incubation period. It is thought to be anything between 5 and 14 days. During that period, one may not have any symptoms at all, but because they are still producing the viruses, there is a small chance that they can spread the virus to other people. Once the disease manifests in a person, then it means that the viruses are quite a lot in the fluids, that is the sputum, the nasal discharges, and even the tears. And when that person has such a huge number of viruses, then after the incubation period they can spread the disease easier to other people. Does everyone have the same symptoms? Not really, but the commonest found symptoms are fever, aches and pains, headaches, running nose, cough, chest pain, and in the more advanced disease, a person may have significant difficulty in breathing. This is because the virus at that time has moved from the upper airway into the lungs, causing pneumonia, and pneumonia is a very severe form of this infection, and really that is what is causing difficulty in breathing or failure in breathing, what you call respiratory failure, and that is what is causing death. So yes, it kills people. Yes, people need to be worried, but majority of the people you have very, very mild symptoms. They will not require to go to hospital. They will not require any medication, and these are people who will get by just by controlling their pains and fevers with even simple medicines like paracetamol, drinking lots of fluids. But there's that group of people who will need to be taken to hospital. They'll be unwell. They'll be having difficulty in breathing. Unfortunately, so far, we do not have any medication for this condition. So if this person comes and finds me, all I'm able to offer is supportive therapy. This means that if the person is in pain, I control that pain effectively. If the person is having difficulty in breathing, I supplement oxygen, and indeed in some cases, people may require to get ventilation support. The basic things are basic hygienes, and really what one should do, if one suspects that they have the infection, please avoid meeting other people. Stay at home, take it cool. If however you are exposed to a person who has a flu-like illness and you greet them or you share things with them or you work with them, the key thing is basic hand hygiene. That means washing your hands after coming in contact with this person. And you can use water, you may use the alcohol rubs, anything that will get your hands clean, you use that. In terms of like children, you control them so that if there is a child who is unwell, please don't ask that child to go to school. But I would like to reiterate that at this point in time, we do not have a proven infection in this country.